All right, good morning, everybody. Welcome to the COVID Emergency Operations Center operational updates for September 16th. Roll call, situation units here. Weather.
Weather's here.
Emerging infectious diseases.
Here.
Contracts, logistics.
Good morning.
Finance.
Good morning.
Safety. Safety will not report today. Public information.
Good morning.
Liaison.
Good morning.
All right, we got some pop-up vaccination clinics for this week. All right, situation overview. Today is day 564. Locally, cases are up 1,736, 12 deaths, and 54 hospitalizations. Statewide, cases are up 4,536, 16 deaths, and 72 hospitalizations. Of note, the 1,095 new COVID cases we had the other day broke a daily record for the most we've had since the pandemic started. For 213 resource requests, we filled or satisfied 1,803, filled one since the last report, and we are currently working 28. For mass care, congregate shelters are up 416, or up to 416. Non-congregate shelters are 458, totaling all shelters of 874. For testing over the last 7 days, we've collected 9,560. In vaccines, prep mod doses are up 450 to 55,083. MOA venues are up 705 to 87,249. End of report. Weather, go ahead.
Thank you. Good morning, everyone. This is Brandon Lawson with the Anchorage WFO. We have low pressure sitting just east of Anchorage today, and that is expected to linger or remain mostly stationary through the next 24, maybe 36 hours. And as a result, today and tomorrow should remain mostly cloudy. We have a slight chance of rain on both days, although not expecting anything significant. Rain chances tomorrow will be even less than today at 20%, maybe around during the late morning, early afternoon hours. Otherwise, that low is expected to begin shifting south and east into the weekend, which should provide some drier conditions, partly cloudy skies, and at least a break from the rain and the cloudiness. So Saturday and Sunday expected to remain mostly clear, and then on Monday, we have a trough coming in from the north and another Gulf low coming into the coast, and that's going to allow some rain chances to creep back into the forecast, probably over the latter half of the day, early next week. High temperatures through the period are going to remain fairly consistent in the low to mid 50s. The main story that we've been kind of hammering is the potential for some colder overnight low temperatures starting Friday night, Saturday night, and early next week. The models have trended a little warmer recently over the last 24 hours, so we may not get to those freezing temps that were possible, but still like overnight lows Friday and Saturday night in the mid to upper 30s, and then that'll probably persist through Sunday night and Monday night. Sunnier conditions over the weekend, but cool mornings. Otherwise, we're not expecting anything major impacts. And that's all I've got.
All right, we're all glad to see a good weekend. Thank you, weather.
Yes, you're welcome.
Health Department, go ahead.
Good morning. This is Dana Loudy with the Emerging Infectious Diseases Program at the Anchorage Health Department. Our current alert level is still high, indicating there's widespread community transmission and many undetected cases. In the last 7 days, we were averaging 122 new reported cases per day, with yesterday likely being a record day in the MOA. Our estimated daily growth rate is 1.31%, meaning that cases are predicted to double in 53 days. And our 14-day average reproductive rate is 1.059, so still above 1. In testing, Visit Healthcare testing sites had a 7% increase in average daily tests as compared to Thursday of last week, comprised of a 7% increase in the sample collections at drive-through community testing locations and a 4% increase in the sample collections at facilities for priority populations, such as assisted living homes and shelters for persons experiencing homelessness. Our turnaround times for Visit Healthcare are averaging around 27 hours in the last report. And Muni-wide, approximately 10% of tests were positive in the last 7 days. As a reminder, percent positivity above 3% indicates we are missing cases, likely because the community may not be accessing the available testing. Another update is we are reintroducing COVID radio at our Visit Healthcare testing sites, which will broadcast the most up-to-date guidance to people who are in line. The LUSAC library will be expanding hours from 7 a.m. to 7 p.m. beginning on September 20th. For vaccinations, we are preparing for the potential authorization of booster shots for the Pfizer vaccine as soon as next week. Clinic information and appointments will be online at anchoragecovidvaccine.org or on the phone at the state helpline 646-3322. Our Visit Healthcare clinics had a 1% increase in average daily vaccinations as compared to Thursday of last week. We have upcoming pop-up vaccination clinics as always, tomorrow at the Muldoon Boys and Girls Club, Tasty Freeze, and Movie in the Park. To date, we have done a total of 508 mobile vaccine clinics with over 13,000 doses given at those mobile events. As a reminder, our in-home vaccination program continues. Those appointments are available online, again, at anchoragecovidvaccine.org or over the phone at 907-531-5100. For monoclonal antibodies, additional public information is available on our Muni COVID website or on the state COVID helpline, which is 646-3322. As a reminder, we have still 2 large monoclonal antibody facilities offering infusions. Appointments are required. And we're working to offer weekly infusions at the quarantine and isolation guest house. Pending any questions, that's the end of my report.
Thank you, ma'am.
Hi, this is Lori with ANMC. Is there any changes that are going to happen to the monoclonal antibodies in terms of what the White House is putting out here lately?
We are continuing to keep up to date on all the latest guidance and working with our partners at the state and also with the administration. We'll keep this group updated whenever we have any announcements to make.
All right. Thank you, ma'am. Contracts logistics. Go ahead.
Good morning. This is Wendy Reese, Contracts and Logistics Lead reporting. For our mass care support, we have a new congregate shelter manager, which is 99+1 at the Sullivan. Services are up and running. We have 32 contract extensions submitted to purchasing to support the contracts through 10/31, and we're working those same 32 extensions through 12/31. Testing and vaccination support. The testing contract with Visit Health is extended through 10/31. We continue to support the EID vaccination team if and when boosters do become part of countermeasures. We continue to support the team in expansion capacity of current vaccination drive-through sites. Logistics, we currently have 28 resource requests that are ready for order status, 5 of which are personnel to support the EOC and AHD of increased operational functions. End of report.
All right, thank you, ma'am. Finance.
Good morning. This is Carrie Wiedeker filling in for Audrey Jo Malone in the EOC Finance section today. Currently, the EOC has encumbered $18,846,660. Our actual spent to date is $79,974,330 for a total of $98,820,990. Please continue submitting invoices and supporting documentation to eocinvoices@anchorageak.gov. Today, I would also like to emphasize our cost recovery efforts. The municipality has received $27,424,529 in FEMA public assistance reimbursement through the efforts of the Office of Emergency Management and the CFO's office working jointly, and they continue to work tirelessly to collect documentation, work with the state, and collect cost recovery as much as possible. It's an amazing amount of work, and for an ongoing disaster to have already recouped close to 30% of what we've spent is amazing, and we should all applaud their efforts. If you have questions about cost recovery, please email Aaron Zachary at erin.Zachary, ZACKERY, at anchorageak.gov, and the email address is on the slide. End of report.
All right, thank you, Finance. Public information, go ahead.
Hi, good morning, everybody. Just want to remind anyone who's listening that the Anchorage Health Department can be heard on the Mix 103.1 every other Thursday at 8:30 a.m. They are there to talk to listeners about the current state of COVID in our community and talking about protective measures that our community can take to help stop this current surge. The COVID-19 response website has recently been updated with a couple new pages on prevention and treatment, specifically the monoclonal antibody treatment. So take a look at those pages if you have not yet. The COVID-19 related calls going into United Way's 211 call center have been steadily increasing. Most of those calls have been questions about testing sites and also questions about rent relief. So we are working with 211 to make sure that they have all the most up-to-date information that they need to answer those questions efficiently and accurately for our community. And that's the end of my report.
Thank you, public information. Liaison.
Good morning, this is Dorielle Welch, Acting Liaison Officer for the Anchorage EOC. Thanks to all of our partners who were able to join us today. Do we have any cooperators who would like to report out?
Morning, this is Gene from the state of Alaska. I can report out.
Go ahead, Gene.
Good morning, everybody. Gene Wiseman, Section Chief, Rural Community Health System. State of Alaska is our primary concern and focus right now is on hospital status capacity and promoting load leveling within the healthcare infrastructure. They're stressed. The actions we're taking currently is we're having discussions, our EMS office is having discussions with local EMS agencies to see if they can work in the space of providing some assistance on either supporting early discharge or alternate destinations. So a lot of vibrant conversations going around that to avoid hospitalization or help them discharge early. Additionally, we are facilitating daily hospital huddles, which has every hospital in Alaska has the opportunity to call in and share their current status and give situational awareness to allow facilitation of patient movement and to help identify any gaps and barriers that they're experiencing. And then we are very close to signing a contract with medical support to come to Alaska. We have roughly 500 medical personnel support tied to this contract. And hopefully, once it's signed, we'll start seeing medical personnel arriving the last week of September. And that includes nurses, patient care technicians, respiratory therapists, and multiple other disciplines as well. Thank you. That's all I have to report.
That's great news, Jean. Thank you for that update. Are there any other cooperators who would like to report out?
Hi, this is Jocelyn from the Alaska Hospitalist Group.
Hi, Jocelyn, go ahead.
Hi. So quick reminder, Alaska Hospitalist Group, we are the physicians at Providence and Mat-Su Regional and Central Peninsula Hospital, both covering medical admissions and the ICU with our intensivist. And just to echo what Jean was saying, we are very stressed in the hospital, doing the best that we can. We have built in our backup schedule and have had to pull in our backup intensivist quite a number of times this last week to support. We've had to deploy our ICU nurse practitioners out to Mat-Su, which is, bulging at the seams, to help support the ICU patients out there as well. So we are in a stage of resource management for sure. Dr. Gonset, one of our hospitalists, was one of the people that testified in front of the assembly on Tuesday, talking about the crisis level situations that are happening currently at Providence. And so glad to see that news get picked up. And again, like our ask is that the municipality acts and does something such as a mask mandate or additional, vaccine requirements, something to make a change, maybe capacity reductions in certain areas, bars, restaurants, gatherings, that type of thing. We know what works. We've been here before. We were able to stave this off in December, and the lack of action has been extremely frustrating for our healthcare workers and families who are losing loved ones as a result. So thank you.
Thank you for that, Jocelyn. Is there anyone else? Okay, next slide, please. Is Jay-Bear on to give a vaccination update?
Hi, this is Lieutenant Cooley from Jay-Bear. Can you hear me?
I can. Go ahead, Lieutenant Cooley.
Hi, yeah. So quick update on our vaccine numbers for the active duty. For our first doses, we have about 21% of the Air Force population that received the first dose. 71% have been fully vaccinated and only 7% are unvaccinated. And that number is 412. So we have just a little bit more till we're fully vaxxed on Jay-Bear for the Air Force. And that's all I have.
Thank you for that update. And I believe that Donald is on leave for the Army side, so we will get those numbers and make sure those are updated on this slide. Next slide, please. All right, so we'll get started with our hospitals. Alaska Native Medical Center.
Good morning. This is Lori Olson. We have 31 positive COVID patients, 9 in the ICU, 9 on vents, and we are still looking for options for morgue expansion. End of report.
Thank you, Lori. And is Sean on from Alaska Regional?
Good morning, I'm on. Alaska Regional Hospital currently has 41 COVID positive patients, 12 ICU, 10 vents. We are pressed for space and staff as everyone else.
Thank you, Sean. And is Nikki or Michael on for Providence? Okay, not here in Providence. I will follow up with them after the call to get updated numbers. Kara, are you on for Matsu?
I am. Good morning. We are currently at 42 positives, 12 in the ICU with 11 on vents, no PUIs. We've expanded our ICU up into our medical unit, pretty much converted our whole entire second floor to negative pressure with reversing air handlers and that sort of thing. And just kind of rotating critical into the ICU, kind of semi-COVID recovered vents to medical floor, and sitting in about the same position as everyone else in Anchorage. Thank you.
Thank you for that update, Kara. And that's all for the liaison.
All right, thank you, ma'am. All right, are there any questions?
Hi, this is Jocelyn. One thought I had was that we might start a campaign around the quality of mask and the type of mask that's kind of appropriate to wear for those that are choosing to wear a mask, given the highly contagious nature of Delta. That might be something that also could be helpful.
All right, thank you, ma'am, for the input. Well, if there's no further questions, the next operational update briefing will be next Thursday at 10 a.m., the 23rd of September. Everybody have a great weekend, and we'll see you then.